There's a lot of myths around testosterone. There's a lot of, in the same way that people think estrogen, take estrogen therapy, you're going to get breast cancer. I think the same is true. You can say testosterone. You might go to a traditional doctor who's maybe not up to snuff on the latest science, might say, oh, it's cardiovascular disease or prostate if you're a male, So talk to us a little bit about some of the myths, because I really want to arm the listeners with maybe talking points that they might approach their PCP, their primary care provider, with in terms of how to gently direct or redirect misinformation around testosterone.
Yes. Two of the biggest ones, as you mentioned rightfully, are cardiovascular risk. And this really started to come into the picture around 2013, 2014. They actually changed the labels on testosterone products and effectively, sort of shut it down, if you will, right? So cardiovascular risk, which then fast forward to 10 years later, the FDA did mandate what was the largest randomized placebo-controlled study around cardiovascular risk and testosterone therapy. That was called the Traverse trial, and that read out in June of 23. Simple conclusion, testosterone therapy does not increase the risk of cardiovascular events, period. And actually in the data, there were less CV events in the testosterone arm than the placebo arm, right? So I think actually where the conversation is going to go is how understanding testosterone's role in cardiovascular health, because if you actually look at endothelial function improves on testosterone therapy. So that's where I think it's going, but again, firmly, that myth still perpetuates today. Despite that study, it's going to take, usually they say it takes 10 years for these things to be fixed. I think it should be faster given the day and age of information that we're in, but that's certainly extremely damaging. And then the second, which is a long time myth for testosterone, is that testosterone causes prostate cancer on the male side. Mm-hmm. Right. And this actually originally stemmed from, there was a study, it was like 1940, there were 3 patients. One was a female, so that's out. And then there were 2 guys, older males.
Nice
and
N there.
Yeah, the N was
2 people.
2. And one guy got prostate cancer, right? Like old men do. So, I think that's been firmly shown. There's saturation models to show after a certain level of testosterone level, there's no impact on the prostate. I mean, a simple way to look at it is like, prostate cancer, young guys who have high levels of testosterone, what's the incident rate of prostate cancer versus old guys who have low testosterone?
Yeah, it's the same comment with breast cancer. It's like, when are you more likely to have breast cancer, as a young woman or an older woman? It's an older woman when your levels of estrogen are lower.
And so there's been studies on both sides. So like we've seen interesting data around testosterone therapy reducing incidence of prostate cancer and actually colorectal cancer. Mm-hmm. And I think some of that data exists even on the breast cancer side.
Yeah, that's super. It's like super cool stuff, and also it's frustrating because you said it's about 10 years. I'd actually counter and say it's probably closer to 20. What we're seeing in the literature usually starts to get out into clinical practice at a delayed rate of like 2 decades. Unfortunately, like now we're only now being like, this WHI thing.
Maybe scary. It's so scary, honestly, right? Because again, the lay patient really doesn't have a clue, so you're going in,
right?
And again, this is nothing against doctors, right? I think the system has set them up where that's how it works, right? Like it's how do you even guidelines, right? I mean, I know this speaking to people from guidelines and whatnot, like how rigid they can be or how unwilling even with new data they will be to move the needle. And this is bureaucracy, this is liability risk. There's so many things that are not medicine that make their way into this decision making, and ultimately, unfortunately, patients are the losers then.